6 benefits of testosterone replacement therapy, TRT. 1. Improved libido and sexual function. Testosterone plays a crucial role in sexual health, and TRT may help improve libido, sexual desire, and erectile function in individuals with low testosterone levels. 2. Increased muscle mass and strength. Testosterone is known to contribute to the development of muscle mass and strength. TRT may assist individuals in gaining muscle and improving physical performance, particularly when combined with regular exercise. 3. Bone density improvement. Testosterone has a positive impact on bone health, and TRT may help increase bone density. This is particularly relevant for individuals at risk of osteoporosis or bone fractures. 4. Mood and energy enhancement. Some individuals with low testosterone levels may experience fatigue, irritability, and mood swings. TRT may help alleviate these symptoms and improve overall energy levels. 5. Cognitive function. Testosterone may have a role in cognitive function, and TRT has been explored as a potential intervention for cognitive decline. However, more research is needed in this area. 6. Fatigue reduction. Low testosterone levels can be associated with fatigue and a general lack of energy. TRT may help alleviate these symptoms and improve overall vitality. Risks of testosterone replacement therapy. 1. Cardiovascular risks. There is ongoing research into the potential link between TRT and cardiovascular risks. Some studies have suggested a possible association with an increased risk of heart problems, including heart attacks and strokes. However, the evidence is not conclusive, and more research is needed in this area. 2. Prostate issues. Testosterone is involved in the growth of the prostate, and there are concerns that TRT might stimulate the growth of prostate tissue. This could potentially worsen benign prostatic hyperplasia, BPH, or increase the risk of prostate cancer. Regular monitoring of the prostate is crucial during TRT. 3. Fluid retention. Some individuals may experience fluid retention, leading to swelling or edema. This is more common in older adults and those with pre-existing heart conditions. 4. Sleep apnea. TRT may exacerbate sleep apnea or contribute to the development of sleep apnea in individuals who are predisposed to this condition. 5. Fertility issues. Testosterone replacement therapy can suppress sperm production, leading to a decrease in fertility. If fertility is a concern, alternative options or additional interventions may be considered. 6. Skin reactions. Skin reactions at the site of testosterone administration, commonly injections or patches, may occur, including irritation, redness, or itching. 7. Breast tenderness or enlargement. Some individuals may experience breast tenderness or enlargement, gynecomastia, as a side effect of TRT. Monitoring and adjustment of the treatment plan can help manage this issue. 8. Elevated red blood cell count. TRT can stimulate the production of red blood cells, leading to an increase in hematocrit levels. Elevated hematocrit can contribute to blood clots, so regular blood tests are important to monitor this parameter. Before we move on, would you please help us out? If you like this type of content, please hit the like button, subscribe to our channel, and turn on notifications. It really helps us on YouTube and helps others see our content. Also check out the description section below for special information to help you in your health journey. Ways to take testosterone. 1. Intramuscular injections. Frequency, typically administered every 1-2 weeks. Location, injections are commonly given in the gluteal muscles. Advantages, provides a consistent and controlled release of testosterone. 2. Subcutaneous injections. Frequency, similar to intramuscular injections, usually given every 1-2 weeks. Location, injections are given under the skin rather than into the muscle. Advantages, may be preferred by individuals who find subcutaneous injections more convenient or comfortable. 3. Topical gels. Application, applied to the skin, usually on the shoulders, upper arms, or abdomen. Frequency, daily application. Advantages, convenient and non-invasive. Absorption rate can vary between individuals. 4. Transdermal patches. Application, patches are applied to different areas of the body and worn for a specific duration. Frequency, typically worn for 24 hours before being replaced. Advantages, provides a steady release of testosterone. Avoids daily application. 5. Buccal tablets. Application, tablets are placed against the gum, where testosterone is absorbed through the oral mucosa. Frequency, usually twice daily. Advantages, non-invasive and avoids injections. 6. Pellets, implanted under the skin. Procedure: small pellets containing testosterone are implanted under the skin, typically in the hip or buttock area. Frequency: pellets may last for several months before requiring replacement. Advantages: offers a long-lasting solution, reducing the frequency of administration. Are there any supplements that increase testosterone? 1. D-aspartic acid, DRR. Some studies suggest that DRR may play a role in regulating testosterone synthesis. It's found in the testicles, pituitary gland, and hypothalamus. 2. Tribulus terrestris. This herb has been traditionally used to enhance libido and fertility. While some studies suggest a potential positive effect on testosterone levels, more research is needed. 3. Fenugreek. Fenugreek seeds are believed to have testosterone-boosting properties. 3. Some studies suggest that fenugreek supplementation may help increase testosterone levels. 4. Zinc. Zinc is an essential mineral that plays a role in testosterone production. 4. Ensuring an adequate intake of zinc through diet or supplementation may be beneficial for maintaining healthy testosterone levels. 5. Vitamin D. Vitamin D deficiency has been associated with low testosterone levels. Getting sufficient sunlight exposure or taking vitamin D supplements may support testosterone production. 6. Ashwagandha, an adaptogenic herb. Ashwagandha is believed to have various health benefits, including potential support for testosterone levels and stress reduction. 7. Ginger. Some studies suggest that ginger may have a positive impact on testosterone levels. It also has anti-inflammatory properties. 8. Omega-3 fatty acids. Found in fish oil and certain seeds, omega-3 fatty acids may contribute to overall health and potentially support testosterone levels. Does fasting increase testosterone? 1. Short-term fasting, intermittent fasting. Positive effects. Some studies suggest that short-term fasting or intermittent fasting may lead to an increase in testosterone levels. Potential mechanisms. The increase in testosterone during fasting may be related to changes in insulin sensitivity, the release of growth hormone, and other factors associated with fasting. 2. Caloric restriction. Positive effects. Caloric restriction, which may be part of fasting regimens, has been associated with potential increases in testosterone levels. Potential mechanisms. Caloric restriction may influence hormone regulation and metabolism, contributing to changes in testosterone levels. 3. Prolonged fasting. Mixed evidence. Some studies suggest that prolonged fasting or severe caloric restriction may lead to a decrease in testosterone levels. Potential mechanisms. Extended periods of fasting or severe caloric restriction may impact hormonal balance, potentially leading to decreased testosterone production. 4. Timing of meals. Meal timing. The timing of meals during intermittent fasting, such as the fasting and feeding windows, may influence hormonal responses, including testosterone. If you want to live your best healthy life, then check out our special links below in the description section. To see more of our videos, research links, and more informative links, check out the description section below. Disclaimer: always check with your doctor before trying anything, especially if you are on medication. This information is just to be used as general knowledge and not medical advice. Thanks for watching our video. Please hit the like button, subscribe to our channel, and turn on the notification button so you don't miss a video.